Good morning, everyone. Dan Bates, President and CEO, Greater Hamilton Chamber of Commerce. We're glad you could join us today for Coffee and Conversations. Today, we're going to be hearing a bit from Michelle Harris for the Alzheimer's Association about education, empowerment, and engagement. I think going to be a very interesting topic. We are on Zoom, so I'm sure Michelle won't mind if you want to ask questions to interrupt her or raise your hand. If you are on Facebook Live, type your questions in and we'll get them answered for you. And this will also be on our YouTube channel at the end of this presentation. So with that, you know who I am, you know what the protocol is. Turning it over to Tiffany for self-introductions.
Good morning, everyone. I'm Tiffany Grubb, Director of Marketing for the Greater Hamilton Chamber. I'm just going to go around my screen here and we will start with Sally. If you want to introduce yourself and what company you're with.
Hi, I'm Sally Roy. I'm with Enjoy Oxford.
Welcome. Cindy.
Hi, good morning, everybody. This is Cindy Keitel with Keitel Business Coaching.
Hi, Sandy.
Good morning, Sandy Kusnoff with Frank's Glass.
All right. Bill.
Good morning. I'm Bill Richter with One Stop Pest Control.
And Gina. Oh, you're muted.
You'd think this is my first ever Zoom call. Hi, guys. Sorry about that. I got a reset password on my email today, so that's what took me a little time. I'm Gina with Land of Illusion, brand ambassador for several different places across the area, like Hothead Burritos. And we would love to host your corporate events. So if you do that sort of thing, let me know. Or if you have little kiddos that would like to have a birthday party at Aqua Adventures, we open in May. Thanks, guys.
Jason.
I'm Jason Michael Miller, Director of Membership and Engagement for the Greater Hamilton Chamber.
Laura.
Hello, Laura Merrill with the Greater Hamilton Chamber.
And I think that's everyone. Dan already introduced himself, so we'll turn it over to you, Michelle.
Good morning, everyone. I'm Michelle Harris. I'm the walk manager for Butler Warren Counties with the Alzheimer's Association Greater Cincinnati chapter. Thanks so much for having me today. I'm very excited to share some information about the association, hopefully educate you a little bit and empower you to have knowledge to go out into the community and help support them where they are too. So let me go ahead and jump in here. I will share my screen and we will get started.
And Michelle, I just wanted to let everyone know that I did put the presentation in the chat so people can download that and look at it later as well.
Beautiful. Thank you. So I will share just a little bit of background. The Alzheimer's Association was originally organized back in 1980. It was by a gentleman whose family had been affected directly by Alzheimer's and dementia, and just really felt compelled to gather together as many people as possible and try to create an environment where they were supported. So today we're going to be going over a few overviews. We're going to understand Alzheimer's and dementia, the difference between the two, how Alzheimer's disease affects the brain, being able to list some of the risk factors, identify the stages of the disease, and also discuss how scientists are working to advance research. That's one of the things that we are most excited about and passionate about here at the Alzheimer's Association, is really just accelerating research, as we've seen some really beautiful outcomes over the last 10 to 12 years. We'll also discuss warning signs. Everyone's concerned about what's natural aging versus what is something that maybe we need to be a bit more concerned about. And so we'll discuss that today, as well as healthy living for your brain and your body. We have things that we can do in our lives at any stage of life that can help actually ward off dementia symptoms. And so we'll discuss that. We'll also identify ways to get involved in the community to support others and even your own family. And then we'll discuss those resources available through the association that can do that. All right, so we'll jump in here to the impact of Alzheimer's. This is just a quick question. If you would, if you're able to, down in the chat, go ahead and list with a heart of the color, or you can just list and type it out. If you know of someone who's living with the diagnosis, if you've lost someone, if you're an actual caregiver yourself, or if you don't have a personal connection to dementia or Alzheimer's, but you know that you do not want this disease. Yeah, most people know someone who has had the disease, and that's really unfortunate. About 1 in 6 people are personally affected by knowing someone who has journeyed through Alzheimer's or dementia. Thank you for sharing those. So today, more than 6 million Americans are living with Alzheimer's, but in the next 25 years, we are expecting that number to reach over 13 million. That's a really huge number, and it is an epidemic, if you will. It's something that needs to be addressed, and that's what we're working on doing. 1 in 3 seniors do have Alzheimer's or another dementia when they pass. And again, just 1 in 3, that's got, when we think about grandparents, even if you have 4 grandparents, that means that you're going to have 1, probably 2 that have some form of dementia at their time of passing. And we want to mitigate that number by that research, by support, by warding off those symptoms in any way that we can. All right, our next question, if you'll answer in the chat, A, B, C, or D, about how many Americans provide unpaid care for people living with Alzheimer's or other dementias? All right, see some different answers here. So the answer is 11 million. So that was answer B. Currently, for those 6 million people, we have about 11 million Americans that are providing care. This equals 16 billion hours of care because people with dementia and Alzheimer's need services generally around the clock. And that's valued at over $271 billion. So if our insurance companies and our government we're diving in deeper and able to support in this capacity, you can only imagine what that would look like for our pocketbooks. So this is just out of love and concern and support for the people that we have in our families that are affected. All right, we will dive into what is dementia and Alzheimer's. So dementia, as you can see in this image, is more like an umbrella of symptoms. So these are the symptoms that we're going to discuss a little bit later, some of those warning signs. And those are the things that we see that we noticed in our loved ones or maybe even ourselves. Those symptoms are the umbrella of that. And then different diagnoses are what we would have under that umbrella. Similarly to something like a diagnosis of autism, every single person is affected in a different way, even if they have the same disease diagnosis. So even with Alzheimer's, every single person is going to have different symptoms, they're going to exhibit different behaviors, and they're going to progress at different rates. So it all looks very different. It's very unique to our individual selves. And so Alzheimer's is our association. That is mainly because that is the most generally diagnosed dementia. It's the most diagnosed dementia. There's also vascular, and we can dive in a little bit more to that. But vascular usually is from a TBI or maybe a stroke. That's when the blood is cut off from the brain and it's affected an area, which causes us to have those dementia symptoms. Lewy bodies is another one that many people hear of, frontotemporal lobe dementia. And then also one that's not listed here, it's a little bit less, is actually Parkinson's disease dementia. So again, these are all different types of diagnoses that have dementia symptoms, and they are affecting the body in a different way, which is that diagnosis is given based on, of course, an evaluation. It's pretty extensive, anywhere from about 90 minutes to 2 hours. And it can be taxing, especially if someone is frustrated. We always recommend having a baseline somewhere around the 50s age, just to try to have that baseline to compare to, because once we start maybe noticing or someone else notices, we are exhibiting a dementia symptom or group of symptoms. By that time, if that's the baseline, we're not actually comparing it to ourselves. We've already started some change and progression, and we'll talk about that here in a little bit with stages. So this can include all these symptoms, dementia-like symptoms, can include cognitive, behavioral, and psychological symptoms. They are biological changes in the brain, which is important to understand. And again, Alzheimer's is the most common cause, but keep in mind that there can be mixed dementias where it's more than one thing's happening in the brain. It's a beautiful, wonderful place, and up there in our heads, and it's very complex. And so mixed dementias are becoming a much more common diagnosis instead of a sure, clear dementia, such as Alzheimer's or Lewy bodies, for instance. Any questions on that?
Seeing anyone in the Zoom chat.
Okay. So in the brain, Alzheimer's affects our brains in a very specific way. And what we do know is that the brain and the heart are connected. So what's good for your heart, which we hear a lot about and we're very aware of, is also generally good for your brain to be operating optimally. We know that from every single heartbeat, 25% of the blood is directed to our brain. So if that is impeded at all, that is affecting, obviously, the health of our brain. All right. So more than 100 years ago, Dr. Alzheimer described specific changes in the brain as plaques and tangles. So the buildup of specific proteins cause these plaques and tangles. The plaques are described as the proteins are building up around a neuron and not allowing it to connect with another neuron, and therefore it's breaking that linkage, that connection. And the tangles, we think of more like a spider web. So they're kind of growing and they're webbing around those connections, the synapses, and that can be intermittent, both of these things, especially in the earlier stages. We maybe don't know quite what's going on, but it's essentially these plaques and tangles are keeping our neurons from being able to connect to recall memory and be able to remember functions and things like that. And it affects every area of our brain. So because of these plaques and tangles, it causes the nerve cells to die, and that leads to shrinkage of our brains. It's not operating at this optimal level, and it's not connecting and firing. And without those connections and firing, they're shrinking away from each other. The neurons are not reaching out anymore. And so that leads to the shrinkage, which affects all of those things like memory and behavior and recall. All right, we'll dive into some risk factors. And here I have one more question for you. What is the greatest known risk factor for Alzheimer's? Let's see what y'all think. Thank you for responding. I saw a lot of age, and that is the right answer. Age. Alzheimer's is not a normal part of aging, and it is the greatest risk for the disease. So, as it states here, our risk increases. It doubles actually every 5 years after the age of 65, and people that are 85 and older are 34%. Have diagnoses of Alzheimer's about 34% of the time. So that's a huge number. Now, that does not mean that genetics and environment do not play a part in that, but age is the greatest risk factor. So populations with increased risk. Black Americans are twice as likely as whites to have Alzheimer's or any dementia. Hispanic Americans come in at 1.5 times as likely. And almost 2/3 of Americans that are diagnosed with Alzheimer's are women. So these statistics are impactful. Where you are in these numbers, should be aware, should be learning more, should have those baseline studies, those evaluations done, and just be, cognizant of those things, so that we can reach out for help as soon as we notice something or other people notice something. It's also a great way to make decisions earlier on, even if maybe you are one of those 2 out of 3 that will not be impacted by dementia or Alzheimer's. We can still prepare for that, prepare for the worst and hope for the best is the saying. And we believe strongly, preparing legally, financially, physically, healthcare, all of those things, and just trying to do our due diligence to make changes where we can with the time that we have. So keep these statistics in mind and be educated, especially within your circle of influence, your friends and your family, to share this information with them so that they can be aware as well. So again, it is not a normal part of aging to develop Alzheimer's. It is progressive, and again, it leads to nerve cell death, which causes that shrinkage from loss of tissue, affects all functions. So it's not going to generally affect one specific area. It might start in one area, but overall it's going to work its way through all of our functions. And again, no 2 individuals do experience the progression or the symptoms in the same way, as we all have our own genetics, our environments, our own neurological paths that we've created and what's stronger than others and that we've had longer. Those things are all affected and considered when our brains are developing this terrible disease. So we will jump into stages now. So as you can imagine, like most things, we are asymptomatic for a period of time while something is happening in our bodies and our brains, and we will not be aware of really anything. And when we get into the warning signs, there's a very clear difference between natural aging and a dementia symptom. However, sometimes it can be stressful, sometimes it can be confusing. And so we'll share more, but that's when we recommend absolutely anytime you have a concern, you're going to reach out to your healthcare professional. You're going to try to get clarity on that. And so if it's a concern for you, then it needs to be addressed every time. Even if you've gone 4 times, my father-in-law, he has a heart condition, and Every time he thinks that he might be having a heart attack, he goes back to the doctor and back to the emergency room, and he's embarrassed when he walks away several hours later, and it wasn't what he thought it was, but he got a little bit concerned, and we tell him, keep going back, keep advocating for yourself, keep reaching out, because that one time that something may be happening and you don't go could be really much more impactful to your life. So same thing. So during the early stages, we're starting to maybe have a little bit of cognitive loss. Again, that can sometimes be confused with natural aging, especially in those very, very early stages. And dementia, as we move into the actual diagnosis, there's mild, moderate, and severe. So just underlined here, mild is going to be interfering with some of your daily activities. Moderate will be many of them, and severe will be most. And again, once that diagnosis occurs, usually people are diagnosed in that moderate to that mild to moderate stage. Many, we do see the diagnoses in severe, but especially as awareness is increasing, people are willing to go and have their evaluations, reach out to their healthcare providers and advocate for themselves earlier, just out of wanting that baseline, or maybe having that concern and being willing to say, I hear you, but I still would like to have this referral. All right, so 10 warning signs of Alzheimer's. Take a screenshot of this. You'll get the PDF as well. I'm going to just cover a couple of these today. The first one is memory loss that disrupts daily life. So an example of that would be names, not remembering what you did yesterday or where you placed something. We talk about keys, for instance. If you have misplaced your keys and you are able to say, okay, when I got home, I had to bring the groceries in. So let me go look in the kitchen. Okay, they're not in the kitchen. Well, I took the groceries out of the trunk of the car. Let me go look in the trunk of the car. Being able to kind of recall some of those places that you've been and go look there, that would be what we would consider a natural aging episode, if you will. And so that would not be disruptive to your life, because yes, you've lost your keys and that's inconvenient for sure, but you're able to trace back where you might be able to go. When you're not able to do that anymore and you're just standing in the kitchen going, I have no idea even where to begin looking. I'm not sure what I'm even looking for anymore. That's something that obviously would be a concern if you had a family member or loved one that exhibited that. Difficulty completing familiar tasks. Some of you may know my counterpart, Jackie Williams. She is our program manager in Butler, Warren, Clinton counties, and she is out in the community. She has a whole team of volunteers that provide education and support group facilitation in the community, because she is just one person across 3 counties. But she was a caregiver for her mother, and she shares with number 3 something when she is educating people, and said that her mom came down one morning because she was a caregiver for her, and she had been making coffee for 50 years. And she came down and the grounds were in the carafe and the water was pouring over, and she was holding, the carafe, but the water was just pouring onto the coffee maker. And she said, Mom, what are you doing? And she's like, I'm making coffee. But she had done this every single day, every morning for 50-ish years. And this one morning, she could not remember the order of events that needed to happen in order to have the coffee made. That's progression. That's a difficulty completing a familiar task, something that you've done regularly, and now it's just not, you're not able to get through that task successfully. And then number 4, confusion with place and time. We see this as one of the earlier signs. Again, they can all vary by person, but confusion with place or time. Someone that's not remembering what day it is, cannot read a calendar, can't remember what they did yesterday to identify what day on the calendar was yesterday, asking multiple times, where they are, when they're leaving, when are we going here, but you're not actually going there. What day of the week is it? What time is it? And just, repetitively asking those things. It may begin, asking multiple times a day. And then I'm sure many of us have had the experience where someone's asking multiple times in a row because they're not remembering that they just asked that question 30 seconds or a minute ago. So those are some warning signs of Alzheimer's. Again, if you notice any of these signs to any degree in yourself or someone else, early intervention is best. Getting to the doctor, advocating. They will do a basic exam at your primary care. However, if they say, oh, we don't really believe that there's anything going on, say, I thank you and I respect that. However, I would like to go have a baseline evaluation completed for my peace of mind and also in the future to have something to compare it to. So again, noticing these things, please go reach out to your healthcare. So we spoke a little bit about planning for the future and early detection. Many diseases can look and present symptoms of dementia, but we want to make sure, and that's why having primary care is important, but also seeking an evaluation might be helpful as well, especially if you have many specialists in your life. So medications can sometimes exhibit when they interact with each other. Sometimes those can present dementia-like symptoms. We also see life changes such as, menopause or grief if there's a death, or maybe even depression. And we talk in our sector a lot about SAD, which is seasonal adjustment disorder, which is kind of a temporary form of, a gloomier, shorter day where we might become more sad or have some depression type symptoms, that can actually cause our brains to have dementia-like symptoms. We can become less aware and less focused and repeat ourselves and not remember things. And so again, looking at the whole person is very important to make sure that we are addressing the right things, and the specialists will help with identifying what those things could be and exploring the treatment options. There are also clinical studies happening all over the world, even here. There's some that are happening at UC, also up in Dayton for local opportunities, and at Alzheimer's Association, we do have a trial match program. So for people who are interested, either with early stages, or even severe, and they're in their later stages of dementia, or healthy persons, we encourage you, if you're interested and willing to participate. This is where we're able to learn more so that we can keep getting that number from 1 to 3, and maybe move that along as we learn more and eventually eradicate Alzheimer's and dementia for the world. Wouldn't that be a lovely place to live in? And maybe our hearts would just give out first. So reaching out for support, we mentioned the primary physician. A geriatrician is a good place to go. They're going to look at the whole person, the whole body. A neurologist, psychologist, psychiatrist, and psychologist. Those are going to be people that are going to have those actual evaluations and assessments for not just Alzheimer's, but dementias. And they're going to look at the whole person and see what medications they're on, what other underlying things could be happening. If there's another diagnosis, perhaps of depression, okay, well, let's treat that and see if that's going to help relieve some of our other symptoms. So again, reaching out for support is important. And of course, we are here at the Alzheimer's Association to provide information and resources to the local community with local support. So we have lists of all of these providers, specialists and such. We're not going to be able to make that direct contact for you, but we give out lists all the time. And I'll go a little bit deeper into our resources here shortly. So I will ask, has anyone heard of any treatments of dementia or Alzheimer's?
Seeing anything in the chat, but we do have 2 questions from
Oh,
a little
sure.
earlier in the presentation.
Yes.
Um, the first question was, do they know why race is such a factor?
Good question. We do not know why. That we just know it is right now, but there is more research happening on our Hispanics and our Black counterparts to identify these things. Now that we've seen the numbers happening, we're trying to explore why the differences in our makeup, even though we're so alike, why that's affected in such an impactful way.
Thank you. The second question is that because women live longer than men?
So we don't know why again. We just know that it is. And keep in mind that the diagnoses generally are happening. We're seeing them happen earlier and earlier. And so when someone has a diagnosis, last year, I believe, it was either in 24 or 23, there was a diagnosis of Alzheimer's in someone that was 29 years old. And so that's very early, of course. We believe that we're getting a little bit better at diagnosing and identifying. We're also becoming better advocates for ourselves and our loved ones. And so we're willing to reach out. We're willing to ask for those evaluations. And we have a very strong advocacy team here at the Alzheimer's Association. But throughout the nation, we are advocating for support. We're advocating for funding. We're advocating for coverage of approved treatments, but also for the evaluations in the proper aspects to try to identify it earlier. And I don't know about you all. That could be true. We're not 100% sure about anything, quite honestly, other than the fact is what Alzheimer's is, and how we can work to ward that off. But I am married and my husband is wonderful, but he is much less likely to go to the doctor than I am without prompting. So that could be a possible reason as well. Yeah, we don't know is the answer to both of those questions. Unfortunately, we just have the data right now, but not the explanation for it.
And sorry to interrupt. Can you go back to the question that you were asking before I interrupted?
Oh, no worries. Yes. So, has anyone heard of the FDA approved treatments? We've had a couple of them come out in about the last 10 years. And I was just curious if anyone had heard or knew anyone maybe even that had a diagnosis early enough and been a candidate for treatment of Alzheimer's.
Don't believe so. There was a comment that said, there have been some high profile cases and celebrities that have brought more attention to it.
Yes.
And then Tiffany Grubb has a question as well.
Sure. Tiffany, what's your question?
Hi, Michelle. I follow this health professional. His name is Gary Brecka. I'm sure you're familiar with him. He always refers to Alzheimer's. I've heard recently of diabetes 3. Any information on that?
So that would be a Jackie question. I will have to get with her and I can get back to you on that if that's okay. Because
Yeah, I had just never heard it. I mean, I'm familiar with diabetes, but I'd never heard that correlation between Alzheimer's and a strain of diabetes before. But what
yes,
he
and
is saying is that it is diabetes 3. And I think he recommends like the is it D2K3 vitamin combo.
I
But
will
I just had never heard that before. It took me by surprise.
absolutely. And I have heard that in passing and I have not asked Jackie that question. So I have a reason to go learn something new today and I will make sure to get that answer to you. Again,
Thank
she's
you.
on the education side and so she hears and fields most of these questions, for instance. But I'm sure she will have resources for me to share with you. So I will
Thank
get to
you.
that. Yeah, thank you. And to Cindy, yes, there have been many high-profile cases and celebrities that have brought awareness, and that's wonderful. The Alzheimer's Association, being a national organization, has also tried to appeal for awareness by partnering with people who have maybe lost someone or have had a diagnosis themselves to take the taboo out of that equation and say, this is a real human issue. This is not, while women are more pronounced in the diagnosis, it's a human issue and it's a family issue and it affects so many people and it impacts families, and sometimes rocks them to their core, which is really unfortunate. We'll talk through some of those things here in a minute, but we want to make sure that people are aware and that they're willing to talk about it, because having the conversation saying, hey, I've noticed over the last couple of weeks or months or et cetera, XYZ symptom maybe, right? And it doesn't have to be necessarily that you have dementia, but I've noticed this symptom. Is something going on? Have you noticed this? And being able to have a real conversation with your loved one, to bring that up, because if we're not talking about it, then we're probably not seeking help. And so that's the main thing. Last year in September, there was an air, or August maybe, there was an airing. We partnered with with Hallmark, and there was a pretty popular movie that came out on Hallmark Channel, which the Alzheimer's Association was a huge part of. And it was meant to be advocating, and it had to do with walk and preparing for that, but also a journey of two people, of two friends that were going down that path, together. One was supporting their friend who had the diagnosis, and it was a pretty beautiful glimpse into what that can look like and how frustrating that can be, but also what can we do about it and how can we empower each other and support each other to have the best quality of life and just love each other where we are in our journeys, whether it's Alzheimer's, dementia, or anything. So as I stated, there are a couple of approved. There are two approved medications that actually slow the progression of Alzheimer's symptoms. So it's actually keeping the brain working more optimally for a longer period of time. I have a coworker, and his name is Andrew. He's the walk manager for Greater Cincinnati. So he provides all the support down in the Sawyer Point area and in Hamilton County, is Northern Kentucky, for Walk to End Alzheimer's Cincinnati. And his mother, she passed away just over a year ago from Alzheimer's disease. She lived with that for over 8 years, and she was a candidate for medication in the earlier stages of diagnosis. And he said that her being on that medication for, about 5 or 6 years, he believes in his core that, having seen other people walk through this journey, that she had such a great quality of life for so much longer. And it actually decreased. While it is it's very expensive medication, it does decrease the overall care that is required, because she was able to stay at home. She was able to stay engaged. She was able to be with her family, and having many of these opportunities that are so important with healthy living, healthy brains, which we'll talk about here in a moment. He believes that she was able to have just a better quality of life for the duration of many of the years that after diagnosis, which is wonderful. So at the association, we are the world's largest nonprofit funder of Alzheimer's disease research. These numbers are pretty big. In 2023, we invested over $1 million for the first time in over 1,000 active projects across 6 continents. So again, this is a human issue, and while we are a national organization, association, we are aware that this is not just affecting Americans, this is affecting the entire world, and we are aware that the most brilliant minds in the world or the most brilliant minds, while there are so many that are here in America, they are throughout the world. And so we want there to be just, opportunities for anyone who has interest, scientists that have interest in exploring this more, to work hard and to support them in their research to try to find something. Every advancement, every answer is an advancement. And so this is part of the reason that we do what we do. All of our services at the association are free to the community across the nation. All of our education, support groups, early onset social opportunities that we have available for people that have the diagnosis and are earlier on, educational series. All of those things are completely free to the community. And we do have fundraising in a couple of different ways that help support these numbers to try to make those advancements in research. All right. So as we mentioned, talking to a healthcare professional, that is most important. At the earliest concern, making that appointment, speaking to them. There are medications, as we discussed. They are treatments to slow the progression. There is no cure for Alzheimer's disease. There is no cure. There are non-drug options also that can treat symptoms. And drug and non-drug options that can treat symptoms such as memory loss. So again, 2 treatments that slow the progression of Alzheimer's, but lots of options for addressing the actual symptoms individually, not the plaques and tangles, if you will. They're available in patch, IV, pill. So we're able to meet people where they are and try to help them slow progression, move forward in a healthy way. Again, not a cure. They work in varying degrees. You do need to be a candidate for some of these because there's a process and they want to make sure that it's not going to combine with something else that you have to take, or if you have a comorbidity, another diagnosis of some sort that could affect, still working through those things. So again, reaching out to the healthcare professional that you trust is most important for your support, for your loved one's support. And again, if you have a loved one, it's great to go in a team, right? You want to go with your spouse, with your parent, with your aunt, uncle, whomever that is, going together so that the questions are being asked and the answers are being received. Just more information. We only get 20 or 30 minutes with somebody, and that's why when we go to these specialists for an assessment or an evaluation, you will know at the end of that evaluation, you won't have your report yet, but you will know at the end of that evaluation if there's a diagnosis to be had, and there's usually time available for those questions. So it's a hard couple of hours, can be frustrating again. However, it can be an answer one way or the other to move forward in an appropriate direction.
Michelle,
Yes.
I have a question. We have a really good friend who has been showing signs of dementia, memory loss for the last 2 years, and he's been going to specialists and everything, and to date, he still doesn't have a diagnosis. Is that common?
If he is going to specialists, the evaluation process is, it's meant to be as objective as possible. However, specialists are who they are, and we are human. And so sometimes there tends to be a little bit of subjectivity to that when answering the questions on the assessment or evaluating the evaluation process for those couple of hours. And memory loss specifically, if there's not other progression, if there's not a reason, like vascular, for instance, if there wasn't a TBI or a stroke, sometimes there can be a delay in diagnoses, and that's frustrating too, but it very well could not be. The frustrating part, Sandy, probably is continuing to advocate and go and try to reach out, but not having that answer.
He's become very depressed because he's not getting answers. Nobody's doing anything in his eyes, and he's progressing to where it's really bad. So it's been a very frustrating situation, and wasn't sure if that's fairly common or if this is just an unusual circumstance.
This is a great segue. I will share, I was going to share resources a little bit later, but it may be helpful to you to share with your friends to have a clinical consultation. So the Alzheimer's Association has in 3 states, Ohio being one of them, clinical consultants, and they are licensed nurses or licensed social workers. We have 3 on staff in Greater Cincinnati, and we have 2 on staff up in Miami Valley and Dayton. And they will meet one-on-one with that family about their loved one whom there's a concern about, and they will meet with them and say, what are your concerns? What symptoms are you seeing? What are your goals for that person? And they will help them develop a plan and help them be connected to the right people. And this is what they do day in, day out. Again, this is all free of charge. It's just making that appointment with a clinical consultant. But that might be a way to go because the clinical consultants hear about, one-on-one, the struggles that families are having in getting that person to recognize that they need to go for it. Sometimes the loved one won't even go to an appointment. They'll create an appointment, they'll make the appointment for an evaluation. They're like, I don't need to go to that. What are we doing today? I'm not doing that. They are doing
He's probably gone to 50 appointments and had every test. So yeah,
Wow.
but that's
Yeah.
good to know that there's somebody I can refer them to.
Yes, and generally speaking, again, the association is a resource. We're not going to diagnose, but we've
Right.
heard a lot, especially on that clinical consultancy side. They've heard a lot, not much that they haven't heard, and not much that they haven't had experience with. So I will share the information with you directly to our clinical manager, and her name is Nancy Payne. I will share that information with you specifically so that they can have a direct line to her if that will work.
Great, thank you.
Sure.
Michelle, I have a question.
Sure.
And this might be unfair because it's kind of a medical question, but the my friend who got Alzheimer's at 53 had advanced Alzheimer's, and brilliant engineer, and declined very quickly. The thing that was weird, though, he didn't remember any of his family members, but he always remembered me. And he became so bad he had to be institutionalized. But even at that point, he was a brilliant piano player, and he could play the piano beautifully right up until he died. He would play the piano until his fingers would bust open and bleed. And the curiosity is how they remember some things so clearly and other things not at all. Can you add anything to that, or?
So again, Alzheimer's and dementia, it's not selective. It affects what it affects, and it's different for every person. We know that calling out healthy memories and happy memories tend to maybe not bring back memories, but allow a person to live with less depression, less behaviors that are, negative behaviors, if you will. So, for instance, the piano may have been a really beautiful memory, and it may have been one from way far back, and maybe that area of his brain just was not affected quite. Maybe it wasn't the earliest part that was affected, and it kind of had to work its way. That was the furthest from where it started or whatnot. But we've seen in some of our long-term care communities that they are starting to, in certain places, they are starting to introduce what they're calling grandbabies. And these are baby dolls that they are bringing in, and not every person wants one, but some people are taking to these baby dolls and carrying them around and caring for them because men and women alike, they have this beautiful memory. They know something was good, or they still have that memory perhaps of having their children. And that was good for them, especially when they were babies and younger. And they're not, these are baby dolls, so they're not crying. They're not having to change them. There's not a whole lot of responsibility with them. But we're finding that that's bringing out more joy than, maybe some negative behaviors of frustration and anger and things like that. So we don't know why. We don't know why it affects what it does. We do believe that, this starts in a certain area of it, for everyone it's different. It will start in a certain area of the brain, and then it's kind of expanding, those webs are reaching out and the proteins start building in a certain area, which is why if you know that you are prone to that, then or recognizing symptoms rather, then it's so important to, again, have that baseline or to contact your medical provider. And I didn't touch on this a little bit earlier, but we do have a biomarker. It's a blood test, and it has yet to be approved, but it is waiting to be approved. We were hoping in 2024 that it was going to make it through, and it did not. So our advocacy is having to start again this year. But they are working very, very diligently to try to have this biomarker available. And once it's approved, then it's getting the insurances to cover it, of course. But early intervention and early diagnosis is impactful. It's going to decrease overall health costs. It's going to make people more aware. It's going to allow them access to care sooner. It's just going to, it's a good thing to have that early diagnosis. And so this biomarker will help people be able to say, I at least need to be aware and look for these symptoms in myself or this, family member or friend or whatnot, and be more cognizant of that, and then have an extra tool in their belt to when they're going to their provider and saying, the biomarker says that I am, tagged for this. I am starting to notice some symptoms, or I am tagged for this and I want to get my baseline so that should I progress, there's something to compare it against. So that's where we are trying to identify, just again, that early diagnosis.
So I have one more question.
Yes.
I was reading a study where they're using things like ChatGPT to help seniors be less isolated. And so, since socialization is such an important part, have there been any experimentation with Alzheimer's patients using, AI conversations to keep them, relevant and thinking?
I do not know about that. I will have to check with Jackie and probably also our clinical manager, Nancy, about that. I will ask. Thank you for bringing that up. That's a good point. Something to, utilizing our technology for good, for sure.
Right.
And as we dive into healthy living, I want to make sure that we touch on this so that we know what we can do to ward off dementia symptoms, and just have a great quality of life in all aspects, whether we are going to develop dementia or Alzheimer's or not. And I did want to share with you, genetics does only make up 1%. So just because your parent or it's been in your family does not mean that you're going to get it. More impactfully is age and your lifestyle, which is what we're going to touch on now. Your lifestyle has huge impact on as to whether or not you will develop dementia. Environmental factors also have some effect on that, and some of those we have control over, right? We can know if we are going to change our filter in the house, or if we're going to live in a home that maybe has an older home that has lead paint in it. We have other things that we don't have control over, for instance, such as maybe our water that comes into our house, whether it's well water from the city. We want it to be healthy. We expect it to be healthy, but we don't know how generally that's going to affect us. And I guess you could probably put in a water filter or something for yourself. And I'm sure some people do. So just keep in mind that environmental things can affect we believe those affect whether or not we're going to develop this, but generally speaking, it's lifestyle. So we're going to touch on these now. Oh, I jumped ahead. That's what I was talking about just now. All right, so the 4 areas that we address when we talk about taking care of yourself and your lifestyle is cognitive activity, physical health and exercise, diet, nutrition, and social engagement. So we'll touch on each one of these now. So physical exercise or physical health and exercise. This includes aerobic exercise 3 times a week for 30 to 60 minutes. This means that it should be a little bit challenging to speak while you're doing this. It can be walking, swimming, biking, whatever that looks like for you, whatever you enjoy. We know that if we enjoy the exercise or the people that we're doing the exercise with, we're going to do it more frequently. This increases the blood flow and the oxygen to the brain. And remember that 25% of every heartbeat 25% of that blood is going to our brain. So we want to keep that blood flow happening and keeping our brains healthy with that fresh oxygen. Also, it is a trigger. Physical exercise is a trigger for biochemical changes that produce new neurons, the blood vessels and connections between the neurons of the brain. It's keeping those healthy. And so again, it's just all of that flow to the brain, the oxygen, is helpful for your brain to be doing what it needs to do and operate at an optimal level. This also would be addressing sleep. So sleep, we know that it's recommended for 8 hours of sleep. The association has a recommendation of 2 hours and 15 minutes of REM sleep. That is kind of the ideal for our brains to cycle through. It becomes harder as we age sometimes to sleep all the way through the night, but our Fitbits, our Apple Watches, our devices that are monitoring our sleep, those can be really helpful to see if we're cycling through the whole sleep cycle, which is very important, and also monitoring our REM sleep to make sure we're getting just over those 2 hours a night, hopefully. All right, next, diet and nutrition. Again, what's good for the heart likely is also good for the brain. Nutrition is fuel for our bodies. It also goes to our brain, helps keep it healthy. Some dietary guidelines can reduce our risk of Parkinson's disease, cancers, heart disease, even Alzheimer's disease, stroke, and diabetes. So keeping in mind, what your diet looks like, eating those lean meats, fruits and vegetables. Of course, I think all of us have learned about this since we were likely in grade school with the food pyramid and whatever it's transitioned into now. My kids are older, so I haven't had to deal with that for about 10 years. But just keeping that baseline of sugars down and sweets and enjoy life, of course, minimal alcohol, things like that. We want you to know that it's good to enjoy things in your life that you enjoy, but what our bodies need and what our brains need really should be at the forefront of focusing on what we're putting into our person. Oops, I'm so sorry. All right. Gina, I saw that you had something here. It says you're hearing conflicting studies that say Apple Watches and monitors are causing issues for people. Interesting. I have not heard about that. I know that monitoring sleep cycles is important. That's something that we share, but I will ask about that. Thank
Yeah,
you.
I would love to know if you hear anything, because
Yeah.
I'm worried because I wear mine all the time and I'm like, should I not be wearing this? So yeah, I don't want any early onset of something I could have prevented.
Of course. We want to try to ward those things off. For
Exactly.
Sure.
Okay, thank you.
Thanks.
Yeah.
These are great questions, y'all. Thank you. All right, cognitive activity. So we're constantly able to make new connections. Even people who have dementia or Alzheimer's, they're able to form new connections among the brain. And that's what we're trying to do. There's still an opportunity to learn new things, even if we're learning it over and over until it's locked in. And that encourages blood flow to the brain, which is what we're trying to what our brain needs and what we're trying to do to keep it healthy. We want mentally stimulating activities. So back to the Hallmark situation, right? We had a Hallmark movie. Alzheimer's partnered with them last year. And we all know how a Hallmark movie ends, right? The end is a happy ending. It ends with a kiss. We know this. It's great to watch Hallmark movies, but once in a while to challenge your brain, because we all know how it ends. We don't have to think about what's happening through the movie. We don't have to engage quite as much. Maybe it's important to watch something different, a mystery or a documentary, something that challenges the cognitive abilities of our brain and just makes it a little bit different. Jackie, my counterpart, the program manager in our area, she shares her sister is an avid reader. She loves to read. Well, reading is wonderful for the brain, but she likes her certain authors, and she will just reread all of those books from her favorite couple of authors. And Jackie challenges her sister once a quarter to read something completely different. And maybe you don't even get all the way through the book, but try to get halfway through the book, make your brain work in a different way from a different author. Don't keep feeding it the thing that it expects. Make it think about something differently. Make it have a challenge. If you do Sudokus all the time, maybe do a crossword puzzle. Again, it's not about finishing the task. It's about just challenging the brain in a different way, because that's going to improve your cognition and work a different area, if you will. Work that area in a different way. So we also have in Southeast Indiana, for instance, I'm the walk manager over there as well. And Ivy Tech Community College, which is in Southeast Indiana, they have something called Senior Scholars. And this is a program for Indiana residents who are 60 years of age or older, and they provide free education. They can register for any class at any of their locations, even virtually, because they know that keeping your brain engaged, even in formal education, can help people stay healthier and live longer. And it can also help protect against dementia. And so that's a beautiful opportunity. Maybe we can talk Butler Tech into doing the same thing. We'll advocate. Oh. I've skipped one. I apologize. Okay, and then the last piece is the social engagement. So to the point of the AI conversations and having that social aspect and conversation, we know that social engagement is associated with living longer and having fewer disabilities. Your community support and engaging with people is so important to the health of a person, physically, mentally, spiritually, all of the ways. It is so important. We are meant to do life in community. We are given families, some family members that we prefer over others, we know. But we are meant to live in community. And so having these opportunities to be socially engaged helps us maintain skills of conversation. It also helps us exercise the other areas, our cognitive ability, our physical health, even our diet and nutrition. Those things can be supported. And so research suggests that the last bullet point, that isolated individuals' mortality increases 2 to 4 times compared to people who have social interactions with family, friends, and community. So we want to keep people lifted up. We want to engage them, and we want to make sure that they are being met where they are. So whether it's once a week and we can increase it to twice a week, or maybe it's 5 times a week. And that's a good thing. We just want to keep engagement, because also we're able to notice things, we're able to support each other, we're able to process out loud, but also celebrate and laugh and have fun. And that's really important, especially as we age too, instead of sitting in our chairs with our television, with our technology and such. It's important to have that engagement. All right. All right, so our vision at the Alzheimer's Association is a world without dementia and all other dementia, or without Alzheimer's and all other dementias. Again, we are the leading provider of funds a nonprofit for research. These are the ways that we are engaging research. We're providing opportunities for people to engage. We have a group called AIM that comes together every summer. It's the brightest minds that are providing or that are conducting these research opportunities throughout the world. They come together and they talk together for 3 to 4 days about all of the things that they're doing, that they're learning, questioning each other, creating new opportunities and new projects together, collaborating for the advancement of research, and that's beautiful. I spoke a little bit on advocacy. Advocacy is very important because we know that at a state level and at a federal level, it drastically impacts the availability of resources at the local level. And so we do have people that have lost someone or are walking through this journey themselves that will go to Advocacy Day. Our Advocacy Day in Ohio is in April. I can get more information on that if you're interested. But the goal is to make your voice be heard. Let them know that you are interested in this topic, that you do not want this, that you want to support what you saw a family member or friend go through, and not have to have anyone else that you are in contact with go through those same things, whether it's a delayed diagnosis or insurance not covering something, or not having access to care for some reason, or even just getting to the point where those treatments, for instance, one of those treatments, the first treatment that was approved, FDA approved, was not covered by Medicaid and Medicare for almost a year after it was approved by the FDA. They refused to cover it. And our advocacy teams across the nation went to DC and fought for that and said, this is approved by your organization, this is approved. Why are you not covering something that can help people? And it was able to be approved. And so again, we just want to make our voices heard and keep advancing so that people have access to the care that they deserve. And then the fundraising, which supports all the things that we do, but mainly research. And we have all these resources in the community as well that we'll talk about here on the next slide. But fundraising is very important so that we can continue. We know that the world doesn't go around without the dollars. And so it's important to get involved in some way. Put your money where your mouth is if you're willing and able to do that so that we can be a part of the solution. As I mentioned,
Michelle,
yes.
I just wanted to ask before we get too far. Sally had asked if going back to risk factors, are
Yes.
people at a higher risk if they already have a neurological disease?
Oh, that's a good question. I believe that they are not necessarily, but I will double check on that.
That is a great question. Okay, thank you, Michelle.
Yeah. I'm just making a note. All right. So Walk to End Alzheimer's. I shared this with you a little bit earlier. We have a Butler Warren County Walk to End Alzheimer's, which is the largest fundraiser in the world, and it supports Alzheimer's care support and research. So right here in Butler Warren County, what Jackie is doing with her volunteers to educate, to provide support groups, to provide early intervention, the things that Nancy and her team are doing, as well as Holly up in Dayton and her team. All of those people are being provided the opportunity through these things that we offer, like the clinical consultations, the one-on-one, the educational series, et cetera, just all the pamphlets and resources that we provide. All of that, as well as the research, really is funded through Walk to End Alzheimer's. It's a beautiful opportunity to come together, to have a walk team with your family, with your friends, with your company, so that you can just come together on that day. There's a QR code there I want to share with you that is absolutely free, $0 to participate. We ask that you register because if you look at this picture, there are these flowers. And earlier, I asked you how you had a connection to the disease. Purple flowers, you would receive that when you register, when you come to walk, if you've lost someone. Yellow is for a caregiver of someone with a diagnosis. Blue is if you have the diagnosis yourself, and orange is if you support the cause but don't have a personal connection yourself. So again, this is completely free. We welcome you to make a donation. We encourage you to do fundraising with your family, with your team, or even independently. but we at most, at the very least, we want you to just participate, be there, a part of the support and care of our community itself, lifting everybody up. It is a walk. You will not get assigned a number. There is no, there is a start finish line, but it's not timed. Only usually kids are running through the course, but it will be at Corwin Nixon Park this year over in Mason on September the 13th. So we hope that you'll join us there. And there are more than 600 walks throughout the nation. So again, we look at that as one event, but there's 600 kind of sub-walks, if you will, being held across the nation in the months of September, October, and very early November. All right, and then some resources that I wanted to review with you. We do offer a 24/7 helpline, 365. These are master's level clinicians who are answering the phone. They are able to help you with your burning middle of the night questions. They're able to help a caregiver who is in crisis in that moment and just has reached their end. They usually answer within 2 to 3 minutes. That you'll go into a queue. They answer within about 2 to 3 minutes, and then after they help you through that moment, through that situation, through that question, they pass your information to your local chapter, and you will receive a phone call from someone from our local chapter to ask if you have any other questions, if we can help get you connected to anything else locally with our resources. And so it's not just a call one time, it's a community. We want to make sure that you're supported in your time of need immediately, but also follow up with you, and you'll see that trend throughout the things that I discuss. Our local resources, again, through the chapters, they are nationwide. And we have support groups. We have early onset social opportunities that get together about once a week. And they will meet at a La Rosa's, for instance. I went to one last month and we celebrated OSU's championship. And so when we did that, we had tailgating, we had some fun decorations, we had cornhole in the party room of La Rosa's. And these are people that have a diagnosis along with their caregiver that are connecting, and they have this opportunity to come together, to laugh, to talk, to say, hey, how's it going? And just be in community. So that's wonderful. Alzheimer's Association and AARP have what we call the Community Resource Finder. So this is available on our website, and this finder allows you to put in what you're looking for and your zip code, and then it offers you a plethora of resources directly very close to you. We don't want you to have to go and chase things down or find them. We're offering that for you. They are not vetted. I will say that. We simply give the list to make sure that you have access to people to contact, because everyone needs something different. Everyone has different preferences and needs. And so we want you to have access to that, and you would call and contact those people on the list to see which person, which organization, which company is most preferred in your family. Online, we have a lot of different educational series. You can look up alz.org/care, safety, driving. These are all going to be very specific to those topics. But we have ALZ Connected, which are our alz.org education, which are all of our educational resources that are on demand, so you can look there. We do have virtual classes as well as in the community. Jackie and her team are always putting things on in the community. And the Navigator and ALZ Connected, these are also ways to get connected with other people in your area that are maybe walking the same thing that you're walking. And the Navigator is to get connected with providers and things like that. Any questions on the resources? All right. So to get involved, we absolutely welcome you to join us for Walk to End Alzheimer's. We are always looking for educators in the community to provide more opportunities for connection and social opportunities for our caregivers and support, as well as those who have a diagnosis. We also have committees that help us get to Walk to Alzheimer's event in October or in September. Kicked off, and make sure that it's a seamless day, whether you show up that day and be a part of a volunteer opportunity that day or part of the community committee leading up to that. And we also, I'm so sorry. We also ask you to consider being an advocate. Being an advocate is not hard. It's maybe writing a testimony, maybe it's showing up to advocacy day in our state, or if you know someone else that's interested in their state. It does not have to be going all the way to Capitol Hill. It can be right here locally, and just letting people know that you do have a connection, that you are interested in this topic, and that you want to see there be progress, be a part of the solution and the end of Alzheimer's. So I'll take any other questions. I know we ran over. I'm so sorry.
Not seeing any on here, but honestly, Michelle, if anyone has any questions, please put them in the chat. But Michelle, I have to affirm, I can tell the love and time that you put into this presentation, and it really showed. You made it interactive, and you broke things down in such a beautiful, digestible, manageable chunk that I think will help us help others.
Thank you. And that's the goal. We just want people to be educated so that if you need us right now, you know we're here for you. And if you don't need us yet, if you or someone else in the future do know, you know where to send them to, so that we can just help them get connected as quickly as possible to resources and support.
Yeah. And in the email that I'm going to send, the follow-up email, I'm going to have your contact information, your email, website, and I've attached the presentation so people can refer back to it.
Excellent.
I'm not seeing any more questions, so I think if you guys don't mind, I'll do just a little wrap up and send you all on your way. So at the Greater Hamilton Chamber of Commerce, we're always doing roundtables and events and holding initiatives and programs to provide resources to help you, whether it's community members or businesses. Again, I do want to shout out Michelle. This was amazing. I've already posted about it on my Facebook. So tomorrow we are continuing providing great resources. We have an HR roundtable series. It's the third of 3, talking about the generational divides in the workplace. That is going to be a virtual session. So really, if you're interested in joining, register for that on our website. You'll get the Zoom link. On the 27th of March, we have a red carpet luncheon called Champions of Diversity, Inspiring Stories. You do not want to miss that. Then on Friday, we are packed with this chamber. On Friday, we have Poorhouse is holding their ribbon cutting for their new pedal wagon, which is going to be awesome. We also have our next Coffee and Conversations is going to be with Zubeida DeWalt, talking about the state of housing. I'm really interested in that. If you'd like to get more connected, we have a networking leads lunch coming up on April 15th. That's going to be at Taqueria Guanajuato, and that's going to be in your email as well. And then followed by a Mix It Up at Poorhouse on April 24th. And then May 15th, red carpet luncheon for the Leadership Hamilton graduating class. If no one has any more questions, I'm going to say farewell to everyone. Let's keep in touch, and I can't wait to explore more on Alzheimer's Association initiatives. Thank you, guys. Have a
Thanks,
good one.
Michelle.
Thanks.
Thank you all.